Welcome to another episode of Influences in Dentistry. I'm Dr. Geeta Perks, and I'm excited to share the inspiring conversation with you today. Let's dive in and learn from another amazing dental professional. Welcome to Dental Focus Marketing's Influences in Dentistry, and today I have Dr. Sophia Richardson, who's an oral and a maxillofacial surgeon. She's both qualified in dentistry and in medicine. And she completed her surgical training in 2012 at the Royal Melbourne and also in Oxford at the Oxford University Hospitals Trust. And she went on to do 2 further years of
fellowship training in orthognathic, oncology, trauma, TMJ surgery.
Yeah. And she's got the full scope of oral maxillofacial surgery under her wing, but she's particularly focused on dental alveolar and orthognathic surgery. Sophia is very passionate about education, and she teaches at the Melbourne Dental School, and she's also a speaker for professional associations. And together with her husband, Jeremy Richardson, who's a plastic surgeon, reconstructive surgeon, she has co-founded Queen's Parade Specialists in Clifton Hill, and she is offering comprehensive surgery, facial surgery for her patients in Melbourne's inner north. So I'm really delighted to have you here, Sophia.
Thank you for inviting me. It's really an honor to have a chat.
Yeah, it is. At Dental Focus Marketing, we talk to a lot of clinicians, and they're at different stages of their growth. And what I really, really love is to hear the stories behind the people who are shaping dentistry today. So that's why I'm really delighted to have you here today.
Thank you.
Yeah. So if we could start by talking about your early days and what first inspired you to take up dentistry?
I had we had no doctors or dentists or anyone like that in our family. My dad was really into history, and my mum was a refugee from Cambodia. So I think she always appreciated health. And I really loved science, I love art, I love working with my hands. So dentistry was a really good natural fit for me. So I did well enough, which was great. And so I got into dentistry, and I really loved working with my hands. I really loved being able to carve amalgam, and so dental school was really such a joy for me, especially because I had a really good close group of friends. Yeah. We're coming up to our 25th anniversary, coming up this next weekend. Yeah. So it's really nice to have gone through that with people together. And then in 4th year dentistry, we got to rotate through all the specialty departments, and I got to go to Royal Melbourne and watch my first orthognathic surgery, and I was just like, whoa, you could do this?
Right.
So then really from there, I kind of thought, I wonder if this is what I should do. And at the end of 4th year, we have our elective. So I went to 4 different hospitals in UK. So I just went to UK for that summer, did 4 different electives at, I think, King's Hospital, Cambridge, Perth, and Newcastle.
Right.
And so I was set on Max Fax from final year.
So when you qualified as a dentist, did you practice in dentistry at all?
I was very fortunate to get the Alfred Hospital job. So I was a hospital dental officer in my first year out. And I think that allowed me the capacity to have access to specialists who would come and really give me one-on-one tutoring pretty much. So I would have a perio session, and Warner Bischoff was one of the consultants, and a few others. And so I would learn from specialists working on the patient. So it was really such an amazing opportunity. Great training.
Right from the get-go.
Very much. And I had a really great oral surgeon who came in, so he only did dental alveolar, but very gentle, very slow. And I think the other great thing about Alfred Hospital is we have a lot of high-risk patients, so all the haemophiliacs, all the HIV patients. So it meant that you had to learn really good skills about prevention and, being careful with your surgery.
Yeah.
And I had time because these patients were booked in for longer sessions, so that was really great. And then at the same time, on the Saturdays, I worked at a local dental clinic at Blackburn. I think they were one of the longest dental practices, the longest serving community dental practices here. So they have built a custom, one of the first ones, which was a properly built just for dentistry surgery. So they've been there 50 years. Amazing. So that was really great, because then on the weekends, on the Saturdays, I got to work in that clinic, and it was very established. It was very well loved by the community, and I got to help on the Saturdays and got to work with other clinicians. So I got to see a little bit of private. Yeah, but that year I also did my primary exams, and then the year after I decided to go to Poole in England, and do another year of hospital maxillofacial surgery.
So you knew early on that turning point for you for going into max-fac surgery was in your fourth year, of dental school. Yeah.
So kind of just try to, it's really funny now. I look back and I'm like, wow, I should have just taken a little bit more time, because I think you learn so much when you can follow other people around, and you learn so much from different systems. And now I'm like, it's only a year. Whereas when I was in fourth year, I was like, it's going to take me this many years to do medicine. It's going to take me this many years to do surgery. I want to get out as soon as I can, Yeah, but now I'm like, wow, I should have maybe done another year of fellowship or something. Yeah.
Well, it's always easy in hindsight.
Isn't it? Yes.
I want to ask you about, do you think you ever had any early experiences that might have shaped your work ethic? Because you're working at that high level and striving for excellence all the way through. So was there anything early on?
I think probably my work ethics is most shaped by my family of origin. So my parents having to work so hard to support us. My mum having not been given opportunities to, learn. So she didn't even finish high school. And then when we immigrated to Australia, my dad found it really hard to get a job because, as a non-native English speaker, it's not as easy to get a job. And then the recession hit at that time as well. We came in 1988.
Right.
So I think seeing how hard they've worked makes me really determined to just make the most of my opportunities. Yeah. So that's probably been a big thing that shaped my work ethic in terms of working hard. I very much have been shaped by other clinicians that I've dealt with in my training and in my life. But, for example, Daljit Darawar, she was just the immediate past president for the British Association of Oral and Maxillofacial Surgery. She's the first British Asian woman of Indian descent to become a max-fac surgeon. And she's just been really a big inspiration for me. So it was really great. I got to spend about 18 months in Oxford with the team there, but she very much taught me very much the importance of patient focus, and last year she had her British Association of Oral Maxillofacial Surgery conference, and the conference was called The Patient's Voice. Every panel had a patient on it. That's the kind of, clinician I got to work with. So that really shaped, shaped how I very much remember one particular clinic where, in NHS in UK, we do the impacted wisdom teeth. And I remember someone else saying, one of the other registrars saying to her, can't we just tape us saying exactly the same thing? Because we say that to every single patient. And then she said, yeah, but that patient's hearing for the first time and it's important for them. And that's your patient. So no taping.
What great advice.
I know, yeah. So you've got to remember, whilst this is very, routine for us, that this is surgery for patients that they are worried about and concerned about. And I just want to feel like everyone has had the opportunity to have all their questions answered, and to have anything that they're worried about discussed.
So you did your training, in Melbourne, Royal Melbourne, and in Oxford as well.
Yes.
And you've got the whole scope of maxillofacial surgery. So tell me about your subspecialities, because you went into that initially.
Yeah, I guess MaxFax is still a relatively new specialty, so there is a whole breadth that we all get taught. And I think originally when I came back from England, I was oncology focused as well, and orthodontics. I've always loved orthodontics, but because I got to do a little bit more oncology in Oxford, I was really keen to pursue it here. And we tried, and you know, I did a little bit of it at Monash Health for a few years. But oncology is really hard. You really need a really good multidisciplinary team that work together. And Monash was a little bit far, and you know, you have to work with ENT surgeons, plastic surgeons, and then all the allied health. And it just became a little bit more difficult for me to be able to contribute the way I wanted, and also then to have to do the follow-up on call with it afterwards.
Oh, yes. All of that on call.
Yeah. And then I guess as my kids were getting older, then I had to think about, could I actually be a good surgeon and be a good mum? And at that time, my husband was also doing a lot of on-call for plastics, and actually plastics get called in a lot. So we decided that only one of us should do, you know, things that may need to go back to emergency care a little bit more.
Yeah.
And I loved orthodontics, so it wasn't a hardship at all. But I must say, it took me a few months to come to terms with it, because for me it was a little bit of a grieving process, that I know that this is something I would never do again, you know? Yeah. Because one of the dreams for us is when we're a bit more established and the kids don't need us as much, we would both love to go and do some medical missions abroad. Yeah, like mercy ships or something like that.
How amazing.
I know. We had looked into mercy ships, but it's really hard with two kids and with two surgeons to want to go at the same time. Yeah, so hopefully one day we can still do that. But I also realize that, you know, oncology skills is much more suited for something like that, whereas orthodontic skills is a little bit less so. I mean, obviously the cutting skills is there, but you know, we wouldn't be doing orthodontic surgery on mercy ships.
So now you're particularly focused on dentoalveolar and orthognathic.
Yes.
So what's the most rewarding thing about that?
I think the most rewarding thing, even just in general, is helping a patient make a good decision for themselves and then helping guide them through it. I will say it is particularly rewarding for orthodontic surgery, because those are patients I actually get to walk with for a few years. So then you get to know them, and that's the thing I miss most about general dentistry. You know, you see someone and you're, oh, how's this family member doing? Or you see the babies grow up, you know, so I miss that about general dentistry, the really continuity and understanding that family, you know. So I get to do a little bit more of that with orthodontic surgery, and it's really nice, like especially when I get the 5-year follow-up and patients come back, and it's really nice to see how they've grown and how they've changed. Orthodontic surgery is a functional operation that helps with bites and airway, but by necessity of moving skeleton, it changes the way that people look as well. So it really does often bring a lot of self-confidence to patients. So that is also so rewarding, because I do find that at the beginning, particularly patients who come in with really quite a discrepancy in size of jaws, if you bring them back to the ideal skeletal position where they can function better and they can actually you know, you can enhance their aesthetics as well. They come back and they're smiley and they're so happy and they're so grateful.
Amazing.
So I really, really love that.
It sounds very rewarding.
Absolutely.
What do you think is the personality traits that are required for a great surgeon?
Oh, well, that's a really hard question, because I guess it depends on how you define a great surgeon, right? But I suppose if we look at surgery on the whole, I think you need to always want the best for the patient.
Yeah.
And that does not necessarily always mean surgery.
Mm-hmm.
And sometimes it means refusing treatment, you know. I do think that it's tricky to define what's one type of surgeon, because I actually think that we don't have enough diversity in surgery. I feel like until every block of profession reflects the makeup of the community which it serves,
Yes.
that we are not actually doing all our patients a good service.
Right.
Because I'm not going to be suited for some patients,
Mm-hmm.
and you know, I don't think capacity and ability and intelligence is defined by gender or any of the other things, you know, your sexual orientation, your religion, or anything like that.
Yeah.
So really, then it means that anyone, given the right opportunity, given the right experience, should be able to do different types of jobs.
Yes.
So I do think surgery needs to reflect the
Reflect
patient's population we serve.
that. Yeah.
Yeah.
Yeah. That's a good point.
Mm.
I'm just wondering, in terms of maxillofacial surgery, when I think about it, and I've done lectures in front of OMFS as well, it's a particularly male-dominated field.
Yes.
And how did you navigate that when you were going through your career pathway? And how did you, was there any particular mindset? Was there a strategy for you to make bigger differences? How did you do that?
Yeah. Look, that's such a great question, because sometimes I reflect on that myself. Now that I'm a bit older and I'm reflecting more back on my journey, there's also a lot of groups that have started up now to support female clinicians.
Right.
And I think it is so important. And you know, my hope is that one day we don't need any of these groups, because gender doesn't play a role. But we are kidding ourselves if we don't think that gender really permeates every bit of what happens, because the system is set up biased and gendered, you know.
Yeah.
And in particular in maxillofacial surgery, because we have to do the 2 degrees, it makes it much trickier. So I think I was very fortunate. I am one of 3 girls. I went to a girls' school. I went into dentistry, which is more than 50% female. Then I did medicine, which is more than 50% female. Then when I got into the training program here in Melbourne, at that time, we were 50% female trainees as well.
Really?
A few of the consultants, when they graduated, have moved into states.
Yeah.
So we don't have as many here now. But I think for me, gender honestly was not an issue until later on in my career, when I realized, you know, it's actually, even some of them is so subtle. Some of them are little microaggressions and things like that. So it's really hard to pinpoint. So I'm really glad. I think I went through surgery not really understanding how gender plays a role.
Yeah.
So I don't know that it would have been as easy for me to have gotten through everything if I had been super aware of it, like I am now.
Yeah.
Yeah, so it is tricky. This is also a conversation we would not have had 10 years ago, right?
Yeah.
We didn't think about this, and we didn't talk about this. And I certainly didn't have time to think about anything aside from work.
Yes.
For those training years,
Yeah.
you know, trying to get through training, trying to study, and then trying to keep my kids alive.
Yeah.
those
those
were the only things.
So you're also a practice owner. We're here
Yes.
at Queen's Parade Specialists. It's beautiful. It's very
Thank
calming.
Thank you.
Coming in here, and I'm just wondering, what do you find most enjoyable about leading a team and running a business?
I think those are 2 different but interrelated things. Thankfully, I have just a really wonderful team, so they are really great to work with. I think the best thing I like about owning a business is that I get to set the direction of what we want to do.
Yes.
Yeah. So when my husband and I sat down to talk about building this, it was really interesting because like the banks thought we were overcapitalizing, you're spending way too much money on this or that. And you know, we did want to build a really beautiful space. I also think that nowadays the luxury we get is time and space.
Yes.
Yeah.
Yes,
so what we
is.
wanted was really spacious rooms, light filled, lots of green, and we like to offer longer appointment times because I don't like rushing and I like to get to know patients.
Yeah.
So those were the things that we wanted to set up, and that's not suited for every practice,
Yeah.
and it's actually also not suited for every patient. You know?
Yeah.
So so then you get to set your own agenda about what you want, what's important to you,
Yeah.
and then you get to pick the team that helps you support that.
Yeah.
So yeah, that's what I love most about having my own business.
Has it been plain sailing all the way through?
Absolutely not.
Have you had challenges?
Absolutely. It's you know, firstly, the biggest challenge for us was opening in January 2020, right before COVID hit.
Oh, wow.
So
Yeah.
we didn't know, right? So we were opening, we were thinking about, oh, should we do a grand opening party? We went from both of us only having one staff member each to having a team of like 5 and 6, so that we can start, you know, servicing patients with more sessions. We were doing sessional work at other places.
Yeah.
So we then suddenly had the responsibility of keeping 5-6 people employed
Yeah.
whilst cutting down our work really drastically.
Yeah.
Yeah, it was very tricky, particularly because we also went from, I was working a day and a half-ish to suddenly working 3-4 days,
Yeah.
you know. So then it also meant, whilst the income went up, it meant we didn't necessarily then qualify for any of the government support because we didn't hit the 30%, you know.
Yeah.
So that was a bit tricky. Thankfully, Jeremy still worked quite a bit because he does lots of things. He does lots of lumps and bumps, you know, skin cancers. So that kept going through.
Yeah.
But all his aesthetic work, he loves facial aesthetic work, and
Yeah.
all of that obviously stopped at that
Yeah.
time.
Yeah.
So it's been hard for us to go, but I think then on the flip side, the good thing about that is it meant that we could really slow down and set up our processes. It could really
Yeah, and the
train our team
systems.
members to run the practice the way we want it to be run.
Yeah.
Yeah.
Yeah. And so that wasn't all from the get-go. That was as you were.
Yeah, absolutely. You
As
get
you-
different people coming on. I think the other tricky thing about running a practice is finding the right fit,
Yeah.
because you can teach skills, but you have to have the similar attitude. And you know, people don't always work out. Doesn't mean they're not a good person. It
Yeah.
doesn't mean that they're actually a really good worker. Just some people don't suit. You know?
Yeah.
Yeah. So that's also tricky, because until you give someone a trial and until they try and contribute, it's really hard to see how that fits is.
Yeah.
Yeah.
That's I could chat with you about that for a long, long time. But
Yes.
I guess you also lecture. You lecture at Melbourne Dental School,
Yeah.
and you also are a speaker at professional associations. So what are the most common questions that people come to you with?
I mean, people ask me a lot of surgical questions or show me x-rays and say, what would you do here? And I guess for me, when I see situations like that, what I want people to be able to do is take everything back to basics.
Yeah.
And I think this is one great thing I have learned from my husband, because plastic surgery is really the only surgical specialty which is all over.
Yeah.
You know, he will work on faces, he'll work on toes, he'll work on anywhere. So for him, everything has to be taken back to, you know, the principles.
Yes.
So that's what I want to empower people with. I do an ADA VB course on a one-day course on suturing and, you know, foundational skills, suturing and flaps and surgical extractions. And I actually warn everyone before they come, or on the first, in the first introduction, if you're here to get a stepwise A, B, C, D, E, I'm very sorry, I'll disappoint you. Because
well, that's most dentists, isn't it?
Yes.
Most dentists want everything
Yes.
like in a...
Yes.
Yeah.
But what I would like to do is take people back to foundational skills and go, what are we trying to achieve here? How do we manage that with the least amount of complication for patients, keeping the most options open for later?
Yeah.
Thinking about the complications that can happen and kind of trying to preempt that.
Yeah.
Yeah. So, yeah. I think it's important because I do think I am also very task oriented, you know, like
Yeah.
step 1, cut this, step 2, line this, you know.
Yeah.
But it's not always that straightforward, and if you don't learn to think in principles, that's when it gets really complicated when unexpected events happen.
Yeah.
Yeah.
Yeah. That's great. You know, little pointers for dentists
Yes.
and students.
Yeah.
So that's interesting because I've come across dentists, and we come across dentists who want everything as, you know, in a systemized way. So yeah.
I think because we like to feel like we've achieved these things at the end of the day, so you can just tick, 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 tick,
Yeah.
you know?
Yeah.
Yep, and I've done it all, so you give yourself a gold star.
Yes,
you know?
that's right. That's
Yeah.
the gold star.
Yeah.
My next question is really about your experience, and in terms of patients and helping patients to feel informed, feel confident in taking up surgery. And what do you think that is? Do you think it's communication with the dentist? Do you think it's digital information? Or do you think that it's written resources that make the biggest difference in your view?
I think all of those things make a difference. And I mean, this is one thing I learnt about, you know, working with a team. Everyone's learning style is very different.
Yeah.
And so it's really difficult at the first meeting to figure out what that patient's learning style is. I am super visual. So I have lots of visual aids. I show lots of models. I draw pictures and I show patients that. But then I recognize that some people don't remember that. So then I follow on with, you know, a printed brochure that we email to patients after our discussion.
Yeah.
So I think it's nice to be, you know, both talking about things and explaining in words, showing it in pictures, and then giving written information.
Right.
Because if you do all 3 of those things, then it would help the patient remember and understand.
Yeah.
And as to helping patients feel informed to make a decision about surgery, I think the biggest thing for me has been learning to think about surgery not as surgery. Mm-hmm. Like the procedure and the operation itself is one bit of this patient journey.
Right.
You know, so my job is actually primarily an educator. I have to inform the patients about how, you know, what we see, what are the consequences of doing something, what are the consequences of not doing something. This is what surgery entails, these are the risks. And now you have to think about how all of this relates to your own personal situation, and then you make a choice that's best for you.
Yeah.
And then whatever choice they make, you help guide them, you help facilitate that. And then the surgery is one important part of it in the end here, followed by the post-op care.
Yeah.
So, you know, and I think flicking from I'm a surgeon, I operate, to I'm a surgeon, I educate and I get to operate sometimes,
Yes.
has been the biggest switch for me.
That's great.
Yeah.
Yeah, that's great. Little pointers again. And you've built this amazing career in surgery. You are a business owner. You lecture and you teach. You're an educator, not only to dentists but also into your team. And you're also, you know, a mum.
Yes.
And family life.
Yes.
So how do you feel? How do you get motivated? How do you find the balance in all of this?
I think it's so tricky because, firstly, I don't think balance exists in the way that I had pictured it 20 years ago. I think when I started my journey and I was thinking about having a family, I kind of pictured a scale, and you think, how do I keep things even keel? Yeah. But I feel like it is not like that at all. Like, for example, coming to end of years, it's always super, super busy. So obviously you do a lot more work and a little bit less of the other stuff.
Yeah.
And then when you're on holidays, I just want to switch off and I want to party
Perfect.
hard and play hard and do adventurous things with my kids.
Yeah.
So then you switch off, you know, and you try and, you know, obviously you make sure your patients are covered, but then you try and really get to fill up your own bucket. So I think I see it much more now like, how do I integrate life and integrate work so that it works together, rather than trying to achieve the balance that I know would never come.
Yeah.
So sometimes it means much more work. Sometimes it means I say to the kids, can't be with you this weekend, can't do anything. Sometimes it means I have to go, okay, well, this is not urgent task that I have to do today. I'm going to go watch the basketball game, or you know, I'll drive my kids to this or that. And the other great thing about being my own, you know, business owner is I get to dictate my time.
Yeah.
So, you know, I have decided for me four full-time clinical days is full-time for me.
Yeah.
So I have one day off a week to try and catch up with whatever clinical things I haven't done or admin. I want some me time, so I want to look after my body. I think especially as we get older, I'm starting to realize that that was never a priority for me. I didn't do that through schooling. I was a musician as well, so I was playing piano and I was really trying to protect my fingers.
Yeah.
And enough, you know, enough academics and enough music means there's no time for anything else.
Yes.
But now I'm really paying the price for it with going, oh, it's really hard to actually go and get motivated to go get fit when you've never had that in your life.
Yeah.
So I'm really trying to build in things that I do now. You know, I've started
Wonderful.
rowing this year, so that's been really, really fun. It's so incredibly difficult, like just so many different things to incorporate into a stroke, and I really love that aspect of learning something new.
Yeah.
And actually this morning, I rowed this morning, and this morning when I was rowing, I was actually thinking, I wonder if this is how a new dental student feels the first time they do a, you know, drill a hole or something, you know, because there's just so many things to think about, like, you know, undercut, do this, do that, and it's really hard to incorporate it all. And what you want to do is just kind of learn it so it becomes you know, unconscious.
Yes,
Yeah,
yes.
so-
I've done a little bit of rowing, but not what you're doing, and
no,
learning all the different, you know, the different moves.
I've only started. I only started a few months ago, but I was very proud last week to get my first callus.
Oh,
So
there you go.
I know I'm quite impressed with myself.
Yeah. In terms of the future of OMFS, what do you foresee that to be, and what's happening in the surgical field? Because we've seen a lot of changes in AI technology, both in dentistry and in business. And what is happening in the surgical field?
Look, I think one of the big things that is happening more recently, from what I discussed with my colleagues, is the introduction of AI into administrative roles.
Yeah.
So, you know, using AI scribes and maybe even AI like radiographs, diagnosis.
Yeah.
So I think that's kind of the more immediate. I actually don't know long term. I feel like you need someone to be there to you know, like surgery, it's so hands-on. You need someone to feel, to see. You need to see where the bleeding's coming from so you can control it. You need to assess each patient's, you know, for me, for orthodontic surgery, you not only need to assess where the skeleton is, you need to see where the soft tissue is, you need to see how each movement would impact the lips, the nose, everything. So I don't know that AI will come into surgery as much, but hopefully it means that we can reduce the burden of administrative work or other work that doesn't need as much higher power thinking, and then concentrate much more on making patients, helping them feel informed, and spending more time with patients so we can be much more patient focused. That's what I would hope.
So just increasing the productivity and and being there for your patients.
Yes, because I think our patients are our patients are much more discerning now than even 20 years ago. They have read up, they understand lots more things. They actually need a lot more explaining now than previously.
Yeah.
Yeah.
Some fun questions for you
Okay.
now. Where have you been that's the most interesting place, and why?
Oh, I grew up in Asia and my parents love traveling. So I have traveled quite widely. We traveled to Africa this year, and that's probably been the most interesting for me because I think I was very used to Asian cultures, and I'm very used to, your kind of European, Anglo cultures. So traveling Europe and England is wonderful, but it never felt like, wow, this is so new. But Africa was that for me this year.
Yeah.
So that was amazing. We went to Kenya. We got to spend 2 weeks in an orphanage, seeing the kids there and just seeing how joyful they are and seeing how they lived with so little but just made so much of it. That was so impactful. And then seeing the wild animals in safari, that was really mind-blowing.
So I love that.
Yeah. So, but I'm looking forward to, I would love to go to Antarctica one day.
Yeah, me too.
Yeah.
Yes.
We should go do a cruise together.
Yes, we should. Pets? Do you have any pets?
No, I've got 2 kids. That's more than enough for me. Also, we thought about it because I think pets would be a great way for kids to learn some responsibility.
Yeah.
And also, I love that pets give unconditional love.
Yeah.
But because I like traveling, it makes it much trickier if we wanted to go off. So every school holidays, we take at least a week off.
Yeah.
We may not actually go anywhere, or we might just be driving somewhere. But I just need a bit of a break, and it's nice to have, and it's nice for my team to have a week without me every 3 months. For them to just do some catch up and slow down a bit. So it's really hard if you're thinking about putting pets away every few months.
It is. My final question is, what's the one thing that you always make time for every single day?
Oh, that's a really hard one.
Yeah.
I think for me, I would like to make time for my children. And so actually this does sometimes mean, my letters don't get done when I think it's going to be done, because there has been so many times where my kids have come up and said, can you please help me with this? My daughter is great at coming up to me and saying, this is due in 2 hours. Can you please cut 500 words down to 300 words for me? Or my son is particularly good at coming up last minute going, I've got a piano lesson tomorrow. Can you help sit and practice with me? So
just making more time for them?
I'd like to, yes. I think that's probably what I would make time for most. I do need to start thinking about making more time for myself. I want to do more Pilates.
Yes.
We got ourselves a reformer, so
Fantastic.
I should make time every day for that.
Yeah.
So I'll, now that I've said it to you, I will try that even more.
There's accountability.
Yes, and now everyone else as well.
Yes, everybody's.
Yes, next time anyone can come and ask me how my Pilates is going.
Yeah. Well, thank you so much, Sophia. It's been an absolute delight. I feel like your journey from dentistry to medicine to max fax surgery to business ownership and education and also family life. I think it's incredibly inspiring, and I feel that what you've shared with us has been valuable. You've talked about training, leadership, resilience, navigating what is now like a male-dominated field, and also finding balance in an unbalanced kind of way, and just finding that normality. So I think our audience is going to take a lot from this, from your honesty and your experience. And I feel like conversations like this really highlight how communication, trust, patient education in dentistry and in surgery, it really matters. And that's something that we're really passionate about in Dental Focus Marketing. But Sophia, I just want to thank you for your time and your wisdom. And anyone who wants to learn more from Sophia or to connect with Queen's Parade specialists, we'll put the links in our show notes. But thank you all for listening to Dental Focus Marketing's Influences in Dentistry. And thank you so much, Sophia.
It's
Thank
great.
you.
It's been so easy to have a chat with you.
Yeah.
Yeah.
Thank you so much.
Thanks.
Please note, the views shared are personal to our guests and not official advice. All treatments carry risks. Consult a qualified health practitioner to determine if a treatment is right for you. For surgical or invasive procedures, seek a second opinion from an appropriately qualified health practitioner. Always consult a licensed health professional for your specific concerns. Enjoy the show.